Welcome to the MDAdvantage podcast. This is Steve Adubato. We speak to a whole range of medical, clinical professionals, healthcare professionals, and it is so important, particularly at this time, that we try to understand what clinicians, particularly physicians, are dealing with right now and the patients that they are taking care of in this COVID-19 crisis. And in this particular edition of MDAdvantage podcast, we are honored to be joined by our good friend, Dr. Steve Libutti, who is Director, Rutgers Cancer Institute of New Jersey, Senior Vice President, Oncology Services, RWJBarnabas Health, and Vice Chancellor, Cancer Programs, Rutgers Biomedical and Health Sciences. Dr. Libutti, good to talk to you.
Good to talk to you too, Steve.
As we get into this, Doctor, let me ask you, I asked you this right before we got on the line, but I asked you this as we were doing the podcast. How are you and also your clinical professionals, the physicians in particular, holding up during this crisis?
Well, thank you for asking, Steve. So we're holding up. I am extraordinarily fortunate to be surrounded by an amazing team that are truly superheroes. They are working extremely hard under very challenging circumstances and in many ways unprecedented circumstances, but I'm just humbled every day by the amazing job that they're doing on behalf of the patients that they serve. So we're hanging in there. We're doing well, and I hope you and all of your team are doing well as well.
We are, and thank you for asking, Dr. Libutti. You know, it's interesting because so much focus, appropriately so, is on patients dealing with COVID-19. The question has to be asked, as it relates to the work that you and your colleagues are doing, is what specific challenges does that cause or create in terms of managing cancer, the care for patients dealing with cancer with an infectious disease pandemic going on?
So it absolutely presents challenges, and cancer isn't taking a holiday to let us make our way through the pandemic, and so we still have the mission and the obligation to take care of our patients with cancer at the exceptional level that we try to care for them each and every day. And some of the challenges are cancer care is a very hands-on situation where you have an emotional bond with your patient and your patient's family, and it's our practice to be very engaged in an interactive way with our patients. And so the first major challenge in a pandemic and infectious disease crisis is that you have to distance, and you have to distance to protect the patient because patients with cancer are more vulnerable to the morbidity and mortality of COVID-19, and those that are immunosuppressed may very well be more susceptible to infection. And so for the safety of the patients and the other patients that we care for, we've had to leverage technology. We're using more telemedicine to have follow-up visits with our patients and even initial visits in order to make certain we're still evaluating cancer patients as best we can, but at the same time protecting them. But there are situations like patients on active therapy getting chemotherapy or getting radiation therapy where obviously you can't do that remotely. And so the challenges posed by the pandemic are our ability to continue to deliver that care, keep those patients safe, and also keep our workforce safe during those encounters. And so we have things in place to do that. We use personal protective equipment. We use social distancing, that is, we'll extend our hours for caring for patients so we have fewer patients at any given time, and do some other things to try to create distance between visits and between patients. But those are the main challenges, our inability to do what we ordinarily do and love to do, and that is physically wrap that blanket around the cancer patient, but for their own protection have to do more distancing than we usually are comfortable with.
You are listening to Dr. Stephen Libutti. This is the MDAdvantage podcast. I'm Steve Adubato. Doctor, let me follow up with this question. With the pandemic that you and your colleagues are dealing with every day, every minute of every day, are there oncologists in the system, in your system, that have been diverted to COVID-19 care teams? And if so, what impact has that had?
So we're working very closely and in concert with our hospitals and the other healthcare teams and providers that are facing the pandemic and providing direct care to COVID-19 patients. And so we have made our providers and staff available to those teams, meaning volunteer to serve on these various teams. So far, the hospitals across our system have not needed to call on our cancer providers, although they stand ready to do so. We have had some of our nursing staff support some of these efforts, but we're very careful with respect to that. While we are absolutely available and want to be to help with the challenges of the pandemic across the workforce, we're still careful to make certain that appropriate personal protective equipment, appropriate separation of those folks that are caring for COVID-19 patients and those folks that are caring for cancer patients is adhered to make sure that there isn't, sort of the cross-contamination that might occur within the feasibility of how we're structuring things. And so far, we've been able to do that. And it requires communication and partnership. And we are fortunate, again, that within our system and the hospitals within our system, the cancer program works seamlessly with hospital CEOs, administration, chief nurse officers, et cetera, to make sure that we could meet the needs of the pandemic while at the same time continuing to care for our cancer patients. And right now, at least, we are continuing to provide that care. We are still engaged fully in caring for and treating cancer patients despite the challenges.
Dr. Libutti, the Cancer Institute that you lead, to what degree is the Institute connected to and involved in COVID-19 research, and also not just the Institute, but the larger Rutgers community? Please share your thoughts on that.
Sure, my pleasure. So we are very much engaged now with respect to leveraging our infrastructure and intellectual capabilities at the Cancer Institute and Rutgers writ large in focusing on SARS-CoV-2 and COVID-19. Some specific examples are, as an NCI-designated comprehensive cancer center, we have a very well-structured and robust clinical trials operation. And it became evident to me early on through conversations with my non-oncology colleagues at Rutgers that there was a need to launch some clinical trials urgently to test some agents that appeared to have promise in treating patients with COVID-19 in Europe. And so we marshaled resources at the Cancer Institute and designed, wrote, and launched a randomized clinical trial comparing hydroxychloroquine sulfate and azithromycin to hydroxychloroquine sulfate and then to a control arm receiving supportive care in an effort to try to answer the question definitively, are these agents effective? And so that is a trial being run by the Cancer Institute, supported by Cancer Institute resources and some very generous philanthropy from individuals as well as corporations to help us accomplish that study. But I think it's the strength of our infrastructure as a cancer center and the partnership we have with the IRB and the FDA that we were able to get that trial written and launched within 10 days. It's a personal best that I don't think I'll ever break in terms of speed from trial concept to first patient enrolled. But that's one area where we are focusing our resources. Another, from the Cancer Institute perspective, is we do a lot of work on cancer immunology and cancer immunotherapy, and we're very interested in developing immune-based strategies for treating cancer. Well, we've focused some of the strength there, both intellectual strength from our researchers as well as resources to focus those same immunology, immunotherapy studies now on SARS-CoV-2 and COVID-19 to develop perhaps new ways of vaccinating folks against the virus, as well as new therapeutic strategies, either to mitigate some of the immune side effects we're seeing, that is, your own immune system fighting SARS-CoV-2 can actually cause some of the morbidity from COVID-19, and so we're looking at that. Rutgers, more broadly, is engaged in a lot of efforts in this pandemic and has actually stood up an institute within our Immune, Infection, and Inflammatory Institute, a specific institute or center focused on COVID-19, led by David Allen, who some may be aware developed the 45-minute SARS-CoV-2 test. And that institute or center is very focused now on supporting research specifically in this area. And our folks, our investigators involved with that institute actually launched a healthcare worker study where they enrolled 700 healthcare workers and others, controls, within a week and tested all of them for SARS-CoV-2, and now we'll follow them to understand how often healthcare workers are becoming infected on the front lines and what can we do if they do become infected. And so a lot of research happening both at the bench and clinically at Rutgers focused on the pandemic and what we can do to help gain information and hopefully advance treatments and prevention as quickly as possible.
Final question, Dr. Libutti. I was speaking to Barry Ostrowski, the CEO of RWJBarnabas Health, about the future and what it may look like and what's going to be normal or going, quote, back to normal, or whether there's going to be a new normal in terms of care and healthcare and clinical efforts to help patients. What do you see as the new normal moving forward? Because it doesn't seem like we can ever go back to what we called normal, because it's not going to help us be ready for what we just dealt with. Is that a fair assessment?
I think it's a very fair assessment, and I think a real-world example I can give you is, as a result of the pandemic, the cancer programs across the state of New Jersey, so not just within an individual health system, but all of the major cancer programs in the state now get on a WebEx call every Friday morning, and tomorrow will be our third such statewide call. And we're sharing best practices, we're sharing what efforts we're making in research and clinical trials, we're sharing how we're handling patient safety and how we're handling our provider and our staff safety. And this kind of collaboration that's happening in the face of the pandemic, I think, is making all of us stronger and better at what we do. It's certainly my hope that kind of inter-system cooperation and collaboration will continue after the pandemic, making us better positioned to deliver even better care and service to our patients and to be that much more prepared when we face something like this again. And so I agree, there is no going back to what had been norm, but I think the new normal, if there is any silver lining in all of this, might make us better positioned to be even more effective in caring for our patient populations in the future.
Dr. Stephen K. Libutti, Director of Rutgers Cancer Institute of New Jersey and Senior Vice President, Oncology Services, RWJBarnabas Health, also Vice Chancellor of Cancer Programs, Rutgers Biomedical and Health Sciences. I cannot thank you enough for joining us. Thank you, Steve.
Thank you, Steve. Thank you.
On behalf of Patricia Costantin and the entire team at MDAdvantage, this has been the MDAdvantage podcast. This is Steve Adubato. Thanks for joining us. We'll catch you next time.